I became interested. They had various healers of one kind or another in the Philippines, and I had a kind of an interest, a passive interest really in it, because you read about it. And I had developed, and it came on slowly, but it did continue to develop, a large, almost, it looked like about a half of an egg, like a hard-boiled egg cut lengthwise, but about a half. So it came up, developed on my arm, a growth, and the skin protruded, and you could see the growth. It was getting large enough that you could see it through my shirt. So I went to one of the people in the office, had a brother who was the head of surgery at the university, a university hospital. I think it was East West University. And his brother was in charge, so he said, well, I'll arrange to have you admitted there, but you ought to go in for a workup first, and he wants you to come in, and you'll have a good surgeon work on this. It'll have to be cut out. I did go that, and the very short version is that they did look at it. They said they thought they could remove it, but they should take a biopsy after they opened me up, because they said they're not sure, but they didn't think, they thought it was benign and just a matter of taking that out. But they said it's painful enough removing that tissue from in the muscle. It usually sort of gets around the muscle. We had scheduled a time over a weekend. That was about 5 days before, and they'd scheduled a time to go in. In the interim, before that weekend came, I was visiting with a friend of mine who was a psychologist from the University of Minnesota, and I had met him. He was a consultant for somebody else, but he was interested in a lot of different things along this line, and I didn't know it at the time, but parapsychology was one of them, and he was interested in these matters. And I said, well, that is interesting. And do you know any of these people that perform psychic surgery of any kind? He said, yes. He said, matter of fact, I'm going over, he said, and I'm on Saturday, and I'm going to see one of these actually operate. And he said, I've gotten permission to take pictures. And I had this, of course, I had this cyst in my arm, but I wasn't really thinking of myself that much as I was the psychic surgery that I wanted to see, just how it was done. I got there, and I was a little bit put aback, because the place was just a little apartment, a little Filipino apartment, and it looked like a typical two-room apartment with a little kitchenette and toilet facilities. And here's a fellow that it was the psychic surgeon that I had heard about. I think his name was Blanca or Blanca. And he was well known, or reasonably well known in the Philippines. Anyway, I was introduced, and this friend of mine was taking pictures, and I watched all of this, and was right around the table as he was doing it. And I was surprised, because I thought there's got to be some trickery here. This just can't happen, what I was seeing. And there were people there, common Filipino people, poor people, as well as one or two Americans, and others had come distances to see him. Usually cases where they thought it was terminal or something. And I understood that he did a lot of different work. So after he had gone through a long line, he had very poor command of English, but he said to one of the people there, as he had an assistant there too, and he said to him, he's got something on his shoulder that maybe should be taken care of, and does he want it to? Does he want to? And so forth. Well, I jumped up on the table, and I didn't have to wait very long. I took off my wrong Tagalog, and I took off my T-shirt, and this was there, and he didn't even come over to the side of the table to examine it. He saw it from the other side of a kitchen. This is just a kitchen table, and some of the patients were lying down on this table, but I was just sitting on the edge of it. But he stood on the other side of the table, and he took somebody else's hand. It was either a patient who had just been there, or was one who was in line to come up, and he took their hand, and he, just like I'll take yours, and stuck that finger out, and he just took like this with his hand, and he went like this. And I was sitting there, and I looked down, and you wouldn't believe it. The first thought that came to me was that it looked like someone had laid a silk thread, a red thread, on my arm. It was just a fine little thread. That's all it was, but it was blood coming there. And then he waited a minute, and then he took that hand again. I think it was a woman that he had, a woman's hand. And it didn't match quite. It was a little dog leg. It came a little crooked at the bottom, so the thing came down like this and like that. Just a slight dog leg to it. Anyway, the thing just seemed to kind of ooze blood around there, and then he came over, and he had an enamel dish pan, a wash pan, you know how these old enamel pans, little round one, but he had water in there, and he had washed himself after each patient, but he never changed the water or anything, and just put his hands in there and took a kind of a rag. It was about the size of a little washcloth or something like that, and it was right there. And then he wiped his hands off with that, and he came over and he started taking the flesh and sort of easing it kind of back. It came open mostly, but he just kind of eased it. Then what he did was he took the fat, and I said that I was supposed to go to the hospital on the following that following Monday or whatever it was, over the weekend anyway, sometime. And I said I want a sample of that tissue. So he got a little baby jar from the people that lived at the house, and got a baby jar, and he just took some of this fat and jammed in the jar, and I did get it, and I had it analyzed later after I got out of there. But the startling thing about it to me was I felt no pain at all, not any pain. I mean, I didn't feel any pain. And you wouldn't even know he was kind of helping it along by pulling it a little bit like that. And I was also surprised. At that point, I really didn't care much because I was already committed. But I was surprised that he took cotton batting and just shoved cotton batting, and that was counterintuitive to me. And this back home, they wouldn't put cotton batting to absorb and leave all of those fibers in there or anything else. They would, if they're going to do anything, they would have put gauze or something. But he just had cotton batting, put it in there, and kind of pulled it together, as I remember. And I don't remember now if he put a Band-Aid or something across it. But nothing more than that. But the thing didn't bleed anyway. I mean, once he closed it, it just didn't bleed. It was. It reminded me, and I think I might have said this at the time because I can still remember how I felt about it. That it was like a piece of pork or something, a pork loin, or and already butchered, where you just cut it open and the skin came apart and looked like red meat in there, you know, but not much in the way of blood or bleeding. Anyway, before he did this, or after I got up, and I was just after he was through with it, then I was going to get some money, give him money, and I went and I remember what I had in my money clip, and I tried to hand it to him, and he just was horrified. He went back against the wall. He just backwards. He went right against, had his hands up like this, and then he wouldn't touch it. He wouldn't have anything to do with it. And I was surprised at that, but I felt so good. I mean, I felt that, you know, this is just really something. So this is independent. I mean, didn't have much to do with that, I didn't think, but I just felt good. And then the fellow, though, that worked with him, this assistant fellow, I put it in his hand, and he just kept it. He took it. So anyway, I was able to give him something for their effort. And then I got my sample, and I felt really so good about it. But I remember I just kind of floated out of there. I was so pleased. And of course, Bernardo, the driver, was waiting down there. The fellow taking pictures. I don't know if he took pictures or not. I don't think I ever saw him again. I know I wasn't interested in anything, but I just felt so good. I remember I came in the door. Somebody unlocked the door, and I came in. And I remember everybody just looked so good. They just looked like they were wonderful people. You know, it was strange.